First at 4 today, Governor Dan McKee and the Department of Health announced just this afternoon a set of new measures to address rising COVID-19 cases in an effort to alleviate pressure on the state's hospital system.
The measures fall into 3 categories and focus on both masking and proof of vaccination, as well as testing and hospital staffing. The measures, which are temporary, will go into effect on Monday.
12 News reporter Alexandra Leslie joining us live from the State House with what unfolded this afternoon.
Well, Brian and Kim, after being asked for weeks about reinstating an indoor mask mandate of some kind, Governor McKee said now is the time to act and that all of Rhode Island's hospitals are at a breaking point.
There's pressure right now on our hospitals and the healthcare industry. There's pressure that could cause more pressure on our economy and also, as a result, pressure on our schools.
Governor Dan McKee says because of this, he's enacting temporary measures to take new action against rising COVID-19 cases during the holidays.
Category 1, indoor venues, including retail, entertainment venues, venues of assembly, and restaurants with a capacity of over 250 people. Inside these settings, masking will be required for employees and patrons regardless of vaccination status.
Smaller venues with capacity under 250, plus all office-based businesses, manufacturers, and other public or private employers with indoor operations will also be subject to either masks indoors or proof of vaccination.
We want to let people know that business is going to continue and that we encourage people to frequent our local businesses, but be safe about it.
The governor said the temporary measures will go into effect on Monday and be reevaluated in 30 days. McKee also said the state's taking action to strengthen the state's COVID-19 testing strategy.
I'm announcing that the state will distribute 100,000 at-home rapid COVID-19 tests over the next 2 weeks. Using these tests, Rhode Island will be able to test approximately 10% of its population over the next 2 weeks.
And the governor also said that he has requested an additional 1 million at-home rapid tests from FEMA, which he says will allow us to test all of Rhode Island's 39 cities and towns. Kim?
And Alex, speaking of FEMA, the governor also made another request of the agency when it comes to helping the state's hospitals.
Yeah, Kim, Governor McKee sent a letter to FEMA today to request medical personnel to provide emergency assistance inside of Rhode Island's hospitals. I also did ask the governor what, if any, conversations were being had about reopening an alternative site like a field hospital. He told me that is not a consideration right now.
And Alexandra, back to testing, an issue we've heard a lot about over the last several weeks. The state also working now to improve the test turnaround times for those state-run sites.
Yeah, Brian, the state's COVID-19 response executive director, Tom McCarthy, said that right now Rhode Island is conducting about 150,000 tests per week, which he says is far above what we were doing last year, and that lab capacity has been completely maxed out right now. He says more sites will be opening to offer rapid testing, but that the state is also exploring opening additional capacity to handle those PCR tests. Back to you.
Lots of information to digest for us today. Alexandra Leslie live for us in Providence. Alex, thank you.